What an eloquently simple way to improve the health, or I should say health outcomes, of so many people just by the consumption of cocoa. And I think that timing of this study was quite apropos. So looking at about the consumption, about 500 milligrams total of cocoa flavanols, which I think had a breakdown of 80 milligrams of epicatogen. Beside the point. This was a randomized, double-blinded, placebo-controlled 2.2 factorial study. And what we're looking at here is a group of people, large group in this Cosmos study of 21,000 plus. And of this 21,000 plus, if you start looking at the chart here, this subgroup of 598 people were studied a little more in detail. And what they discovered was this. You had an 8.4% drop in high sensitivity C-reactive protein, not total, per year. And then the kicker was a 27% drop in cardiovascular death overall in the group consuming the cocoa flavanols. Now, you can do this with dark chocolate if you like, but I think the caloric intake to get an equivalent cocoa equivalent would be about 600 calories. So in this case, it was probably a better route to go with the capsules. And of those capsules, I said to reiterate 80 milligrams of epicatogen, the 500 milligrams of flavanols consumed per day. But beside the point, let's get right into the meat of the study, or I should say the cocoa. Study finds cocoa extract supplement reduced key marker inflammation. Backstory. Nutritional interventions have become an increasingly attractive solution for slowing inflammatory aging, something called inflammaging. You start hearing a lot more of that term as the future proceeds. Cocoa extract has been shown in previous smaller studies to reduce inflammatory biomarkers thanks to flavanols. Small bioactive compounds found not only in cocoa bean, but also berries, grapes, tea, and other plant-based foods.